So this morning we're going to be talking about your famous blue inhaler, Ventolin inhaler. Welcome to this page. I'm Dr. Best. Now, if you're an asthma patient, you must have been conversant with this inhaler. Or if you're not an asthma patient, if you know someone that has asthma and that uses inhaler, you must have been conversant. And we're going to talk about what does this inhaler do and what it does not do. Now, Ventolin inhaler is a short-acting beta-adrenergic receptor agonist. So what do they do? That the major thing that it does is that it relaxes your airways. Now, your airways is like a road that people pass through. So when there is a roadblock that is making the road become so tiny, it's difficult for you to pass through. Now, that is what happens when you have an asthma attack, is when your airways becomes constricted, becomes tight, that air can no longer pass through freely as it ought to pass through. You start having issues and difficulties with breath. So where Ventolin inhaler comes is that it relaxes the airways, widen it, and make sure that it is easier for air to pass through. Now, what Ventolin inhaler does is that it gives you a quick relief. Now, once you use Ventolin inhaler, in the next minute or two, it starts working already. It gives you a very quick relief, and also it helps to stop an asthma attack. So you use Ventolin inhaler when there's an asthma attack. Now, what does Ventolin inhaler does not do is that Ventolin inhaler does not prevent future asthma attack. It doesn't prevent future asthma attack. It only stops an existing asthma attack. And the second thing that Ventolin inhaler does not do is that it does not treat the underlying cause of asthma. It does not treat asthma. There are other things that you can use to treat asthma, your inhalational corticosteroid, but Ventolin inhaler is not what you use to treat asthma. And the third thing you need to know about Ventolin inhaler on this negative part is that it's not supposed to be used for long. If you find yourself using Ventolin inhaler more often, it means that your asthma treatment is not progressing, and you need to visit your medical doctor, your pharmacist, to review your asthma treatment and give you something better, because you are not supposed to use this inhaler more than twice a week. Thank you, and don't forget, it's Dr. Best. Like and follow my page, and see you in my next video. Bye bye.